We're now going to turn to a conversation about the Green and Healthy Homes Initiative, which I'm really excited about. We're very fortunate to have Ruth Norton here. She is president and CEO of the Green and Healthy Homes Initiative, which is based out of Baltimore, and it focuses on the creation of healthy, safe, and energy-efficient housing for America's children. GHHI, as it's known, operates in 25 cities across the country, including the city of Austin. We just became a GHHI city earlier this year, and we're really pleased. She's one of the nation's leading experts on healthy housing, and she has led the efforts to reduce childhood lead poisoning by 98% in the state of Maryland, which is incredible. She's also developed and implemented one of the nation's first healthy homes programs to address the multiple environmental, health, and safety hazards in low-income housing for pregnant women. She's authored, like so many of our speakers, so many articles, and also 30 pieces of healthy housing legislation, and she also manages numerous federally funded grant programs to combat unhealthy housing. So and she's kicking me off the stage, which is fabulous. She is also going to be joined in a little bit with two of our very own fabulous city staff members, Rebecca Giello and Stephanie Hayden, and they're going to continue the conversation after Ruth Ann. Thank you.
Thank you. I stopped, Mandy, because if you have to follow David Erickson and Megan Sandel, your resume will never measure up, and so therefore we ought not to talk about it. So, hello, Austin. I'm so glad to be here. You are a GHHI city, and so I feel at home and glad to be back where I can get Torchy tacos. And I found out that Torchy's now has a bar in their new location. Even better. Really happy to be here. And I want to thank you in advance for your patience for I'm going to meander a little bit, and I'm going to try to go through some of the slides that we have here. But I also want to pick up on a couple of things that Megan so eloquently raised. And so you're going to find that I'm going to jump a little bit in the talk because I'm joined by two great partners with Rebecca and Stephanie to talk about Austin itself and our work there. But I do want to thank the Federal Reserve and Housing Works for inviting me to join in today, and our partners in Austin. I asked for a little bit of purview to do this. I think I heard Megan address it. And I'm big on transparency, so I want to out myself to tell you that I was one of those Hillary Clinton pantsuit wearing supporters. And I know I'm in Texas, but I also know I'm in Austin. And I count Hillary Clinton as a friend and someone who I know had an agenda that was going to be good for the things that I care about. But I will tell you right off the bat that the marching orders on Wednesday was that we have a new president and that we have new opportunities. And for those on both sides of this, I think it's really important to think about the work that you'll hear that we're doing. We are, GHHI, Green and Healthy Homes Initiative, is doing the leading work on healthy housing and social impact bonds and pay for success around the country. I'll talk a little bit about that. We're heavily invested in that as a way to capitalize and scale the work of creating healthy housing, of getting to solutions, of using evidence-based practices that work, and to be able to give to doctors the power to be able to order assessments and interventions that we know are important about kids getting to school, about stability, about the health of families. I think in this new administration, if you get past the hubris of the election, there are golden opportunities for housing. There are golden opportunities for healthy housing, and there are golden opportunities that potentially lay ahead that we have to pursue. And here's my take on it, and I think it's one that is not going to be brilliant, and probably where you are as well. But one of the big things that President-elect Trump talked about on the campaign trail, and I'll say it a little bit better maybe than he did, which is to lift up and rebuild inner cities. And lift up, I will take that as lifting up and rebuilding communities. And he asked the question of people who, whether they were better off, whether they felt they had opportunity or not. And I've taken to, in conversations with his folks, to talk about that around a children's agenda, around trajectory. We have a housing developer who has a spotty track record on his housing side, but is a housing developer and his beginning and his core. So housing development is an opportunity to be in the infrastructure bill, and we are fighting like heck to get it into the infrastructure bill, to see the rebuild of cities and the rebuild of communities. And for us, we have put in a proposal that builds off of rebuilding cities to reduce lead poisoning, to reduce asthma, and to provide better health, economic, and social outcomes around housing. And so before I get into the slides, I wanted to say that I'm kind of asking all of you to take the view that that ought to be part of the infrastructure investment, that there is a website called greatagain.gov where people can go put ideas on there. And whether you voted for Mr. Trump or didn't vote for Mr. Trump, or as painful as that might be or not, it's critical to get those ideas in and to do it. I learned a lesson a long time ago. In the year 2000, in Maryland, when we were trying to really get on top of lead poisoning, and we still have a ways to go, but we had a marker that in 1993, at the current threshold level for the CDC, there were 42,000 children a year with levels of 5 or above in Baltimore City, right? My job was to lower that. We're now down to 354 kids, which is good, but my job was to lower it. In 2000, we were stalled because we didn't have really good work coming out of the state of Maryland. We had an opportunity of a new mayor. So we wrote a plan, we delivered a plan, and we asked for $50 million. And in the absence of them having a plan, they took our plan, they implemented our plan, and they gave us every single one of the $50 million. So one lesson was I didn't ask for enough money. But the second lesson is in the absence of plans, there is an enormous opportunity to push forward. And I can go through, and I probably, the slides I have will go through this. But all day long, to a guy who has run on and won, saying that he is effectively, I think I got this right, the best businessman who's ever existed on the face of the earth, I got a deal for him. Every dollar invested in lead poisoning prevention returns $17 to $221 back to the American taxpayer. I would take that deal if I were Donald Trump or Megan Sandel. I would take that deal. Every dollar invested in root cause remediation in housing for asthma returns a $5 to $14 return. Not quite as good, but much more, bigger universe. In the United States today, we spend approximately $100 billion a year on those two things. What I'm going to talk to you about is work that we're doing that shows that we, by addressing the 40% value of where poor housing condition leads to kids getting into the emergency room in the hospital and adults around asthma, according to my friends at the Robert Wood Johnson Commission on Building a Healthier America, that we can take that 40% and we can drive at least 65% of that down to zero in a 3 to 5 year time frame. and we can return, which I'll talk about in a minute, returns to public and private investors of 23% over 3 years and 72% over 5 years. And again, just a little precursor to what I'm going to talk about. But my point in this is we must take the next step. Get up the next morning and take the next step. However you feel about this election, when I was 13, I had a massive tragedy in my life. And I knew that I had to come out of that, even as a 13-year-old, and take the next step. And we have to do that on behalf of housing, on behalf of children, and we have to do something that is one of the 4 tenets of my organization. We have 4 of them. One is transparency, one is accountability, one is lead with kindness, and the first, actually, is assume good intent. So for now and moving forward, for whoever will be HUD secretary, however the Federal Reserve will be stacked, whatever we do, we have to be in there fighting for the good intent by the ideas that we put forward. So Mandy, thank you for letting me at least talk about that, say that before we get to why I'm here. And I'm going to go through some of these slides because I want to get to the important work around the Center for Medicaid Services and Social Impact Bonds that GHHI is doing nationally and how that will translate down to Austin. But I first want to, before I get started and talk about things, I'm going to skip over some of the things I'm sure that Megan talked about. Let me do what I should have done up front and introduce you to the Green and Healthy Homes Initiative. We were founded in 1986 by 9 parents, all of whom had their children in the intensive care unit at Johns Hopkins Hospital. And they were being treated by a pediatrician by the name of Julian Chisholm. Those 9 parents, at the time, Hopkins was the #1 healthcare center in the US, all those rankings, right? But what that represented was 9 parents who all lived within 2 blocks of what was considered to be probably one of the greatest health institutions in the country. And it represented the twin tragedies of deteriorated housing condition and the health of their children and the future trajectory of their children. So we were founded by those 9 parents with one mission that we try to live up to every day. And that is to break the link between unhealthy housing and unhealthy children, which I find incredibly brilliant because these are parents whose kids were lead poisoned. And their statement that they wrote out was not about lead poisoning, it was about unhealthy housing and housing condition. It took many of us decades to get to the broader issues, but I thought that was so brilliant, and so that's our mission. I was hired to take on the issue of lead poisoning in Maryland in 1993. In the mid-1990s, we became one of the first nonprofit organizations to holistically address issues of other environmental health threats, solely because the parents who came to us and our workers in the field said we're fixing housing for lead, and yet we're leaving behind sick children. So we started building radiator covers and doing pest management and doing roof repairs to try to make houses healthier. And lo and behold, as we became a data-driven, evidence-based organization, we started to see the impact of that in lowering lead rates, in lowering the rates of kids getting to the hospital, right? And by lowering the rates of those kids getting to the hospital, we were not only saving the $8,000 to $24,000 for the hospitalizations, it meant that children were sleeping through the night, it meant that parents were going to work, it meant that we were tackling an issue that besets every state in the United States. The #1 reason that kids miss school, asthma. We started to see improvements in school attendance, improvements in work attendance, which leads to also, as I'll get to, that kids and families were stable. So in neighborhoods for us where 36 to 40% turnover rates dropped to 6%, which meant that children could live without the chaos of fleeing, could settle and sleep, and parents could be more thoughtful, and we could do something about their wealth retention and about the health of neighborhoods. And as I get into this, I will say one of the other lessons we've learned out of this is really good standards that often will make communities afraid actually brought investment to the hardest hit communities in Baltimore. And if you need to know what the hardest hit communities in Baltimore look like, go watch The Wire. And we were able to turn things around with great help from Sarah Norman, who was at the health department, by the way, and who's with NeighborWorks, and you'll hear from. But this is an important thing, that we, at the time of starting all of this, weren't thinking about social determinants. We were thinking about the lives and impact of families. And one of the things, as we continued on our learning curve, that we learned is that even as healthy and as safe as we were making housing, people were still leaving the houses that we were making lead safe and healthy because they were being displaced by their energy cost. So we started to incorporate energy efficiency, and lo and behold, we found out we were driving those asthma rates lower, that the seniors were healthier, and this is what we knew before we knew data. So when the American Recovery Act was raised up, we went to the White House at their invitation to comment on the incoming budget and the incoming investments that were going to be made in energy efficiency. And if you want to put the White House on its heels, say something like this: you're going to invest $5 billion, you're going to seal up houses, and you're going to send kids to the emergency room with asthma, and immediately they said, okay, how do we solve for health and safety while improving the energy costs and energy efficiency? Because what they knew and we knew is that places like Baltimore and Atlanta, where weatherization and energy efficiency had tried to be invested in housing before, there was a deferral rate of 60% of families who were not getting that because they had lead in their house, because they had mold in their house, because they had issues that were keeping them from getting those monies. So one of the reasons that we brought together the GHHI platform of aligning, braiding, and coordinating on health, housing, and healthy, lead-safe, and energy-efficient housing was because we wanted to change those deferral numbers, and we knew that up front, as a delivery system, families could lose as much as 23 days on the front end chasing multiple grants, their lead grant, their integrated pest management grant, their roofing grant, their energy grant. They're going to miss 23 days up front, not to mention their kid who's in the hospital 3 times a year, so 3 weeks there. And we were telling communities, go to work. You need to be at work. But we're going to force you to miss 60 days of work because your kids are sick because of housing, because you got to chase grants. Well, that didn't seem right. So we flipped that on its head, and we formed a different platform. We also know that in doing it, that we are impacting these social determinants around what we're doing. So I want to talk a little bit about the things that we are addressing in our work, but I'm going to skip most of the social determinant piece because I think that you understand that what we are doing is trying to improve health, economic, and social outcomes through housing. Megan will call it housing as a vaccine, and that's a little bit smarter than my pay grade, but it is really about what are we doing to allow people to thrive. And this is the burden that we've all talked about and what we are trying to address. And as we do our data, what we are looking at are those health outcomes around hospitalizations, around lead poisoning, around trip and fall injury. Those are the specific things that we look at. But we go and then look at, are we getting kids to school? Are they able to read when they get to school because they're not lead poisoned? Are we able to get them to school attendance where they can be rested and ready to learn? Are we helping to get parents to work? Are we stabilizing neighborhoods? And on the contractor side, what we know from a study that we did with Cornell University is that by cross-training contractors and helping to make them the new face of healthcare, that we are improving their wages by $4,000 to $8,000 a year from a baseline. And we're saving government about 25% per home in the delivery. So you can pay people more, people can be healthier and more stable, and you can get more houses done. That's a business case that's critically important. So this is when I think about the families who were chasing all of those grants prior to the introduction of our platform, this represents the 238 lines of funding just out of the federal government that actually touch housing intervention from a myriad of agencies. We got good music in the background, by the way. And we were before asking parents to do this while they're trying to run their lives and live in distressed situations, and so we wanted to change that. So we instead tried and put together a platform to align philanthropic investment and to say to philanthropy that invests billions every year on educational attainment and school performance, that if you don't redirect some of that money into housing, you will never meet the success that you lay out. And that's critical. Funders like Open Society, who's one of our funders, who spends money in the criminal justice reform, if you don't look at how do you lower lead poisoning, how do you lower the incidence of asthma to get kids into school, your dollars will never be as good. I live in the city of Freddie Gray. And regardless of, and it's an important, what happened when he died in the interaction with police, but the story of Freddie Gray began when he was 3, and his lead levels were 37 micrograms per deciliter, when we know that there is no safe level of lead. He was a chronic asthmatic and was out of school by the time he was supposed to be in the 7th grade. He was no longer in school. And I think about the fact he moved 4 times by the time he was 3. Had we been able to make his house healthier, safer, stable, might Freddie Gray have not been on that corner? So we look at that role of philanthropy in that. We look at the role of private sector and social impact bonds, and we look at the role of the federal government, because we know that can no longer be the holy grail. And then to address these in an aligned and coordinated manner. So we do a comprehensive assessment and education team approach, which goes through the entire practice, and we'll talk about that more as we sit down and have a conversation about GHHI, but it is critically important to have that clinic to home to school connection for us, having the clinic extension in the home coupled up at looking at behavioral health and housing health together. And we're not going anywhere. There you go. So I'm going to go through the things that we look at in this really quickly. And just to tell you, I skipped over the slide here, that in the outcomes of the work, not only have we seen dramatic reductions in lead, but I think these are important about what we're seeing around asthma in this. So in Baltimore, we've had a 66% reduction in our vetted external studies using medical cost records and empirical records, looking at this. In Philadelphia, we've had a 70+% reduction in hospitalizations, and in Cleveland, a 58% reduction in hospitalizations. Our average cost to address asthma in a home is $1,471. What we are saving just by one hospitalization ranges from $8,000 to $24,000. And for the kids in these studies, this is not going back to the hospital for 3 years at all on hospitalizations. And so we've also seen out of this, in the Baltimore study, and we're about to finish our second one, a 62% increase of moving from frequent absence because of asthma to perfect attendance. That's a big deal for struggling education systems. An 88% improvement in parents' ability to get to work. And as I said, 36% turnover rate down to 6. And for low-income homeowners, we've been able to keep them out of foreclosure. We did a report on this for Open Society that's critically important on that side. So we are looking at how do we break the cycle and how do we change the cycle in this, and looking at these big numbers that we have on lead and the business case. And that's what we are kind of putting on our metrics as we move this forward. So I'm not going to go through a lot of these things that we've seen on data, but just to use my last 3 minutes to tell you what we're trying to do beyond the implementation of the platform, which we'll talk about Austin more. But we have invested a lot around 2 things. One, a look at whether social impact bonds or pay for success or pay for performance works. Is it viable to capitalize this work? So we're in the midst of 11 transactions to say to Medicaid managed care, including United Healthcare in Houston. So we're working in Houston on a pay for success transaction with Hopkins and with entities around the country. We are using actuarial analysis. That's what the Center for Medicaid Services and hospitals use to look at data. This is not our own financial modeling to do that. And we have worked with, and all of that has turned up what I would call on the north side of the grass, right? To put these transactions together where we have outside investors that do include entities like Goldman Sachs, but also include local funders, high net worth funders, and philanthropy. And it is, what we have found is that, as I said, that 23% return over 3 years in many of the locations around the country, a 72% return, meaning savings to state Medicaid programs. So the next step in that for us was to go to the Center for Medicaid Services and say, we interpret your current regulations to allow managed care to enter into capitalization projects and pay for these types of interventions. And we need you to give the go-ahead to managed care so that a doctor truly can write the script, so that an assessment can be done, and so the intervention can be done. And on September 28th, the Center for Medicaid Services said, you are right. So we are, who knew that CMS would get applause? Okay. And then for my next joke. So we have hired the former general counsel, Tom Barker. He is working on the bulletin that is getting released to states. Texas Medicaid is engaged and involved with us on this, for those who are Texas-centric here. And we think it will open the door to tens, if not hundreds of millions of dollars of investment in a short order. You may also see that Medicaid just recently allowed the state of Michigan to invest $119 million in lead abatement, opening the door for other negotiations around that. The state of Maryland's doing a pilot around that. And so I want to talk a little bit more about this in our conversation and a little bit more about one thing that I think absolutely will happen under the Trump administration, and that is the loosening of the guidelines around community benefit dollars, which are smaller but important, to be put into the built environment. So I'm sure I am close to out of time. I will just say these are the sites that we're working on the 11 pay for success transactions. We've done a lot of other interesting funding that we'll talk about for how we might apply that here in Austin, but everything from environmental settlements to public service commissions the Public Service Commission in Maryland determined that the work of GHHI had such good health returns for its energy efficiency investments. They put $42 million into the work in Baltimore. And so we've looked at a lot of different things around that. But we're going to now start a conversation around Austin and move to our living room, right? So thank you very much for allowing me to spout a little bit. Austin became a GHHI site last year. And we are actually in 30 cities around the country that have met a criteria that Austin has met. Our goal is to go to 60 as critical mass. But to become a Green and Healthy Homes Initiative site, you have to pledge to do a number of really important things. One, to establish a housing standard that brings into your calculation of your investment health standards. You have to create a learning network that shares best practices and creates a platform to be able to better and more efficiently get families the services they need while striving to have continual innovation in government. And that you are really data-centric and evidence-based centric. And so we have a criteria that we actually created with the U.S. Department of Housing and Urban Development, with Sean Donovan, who's now at the Office of Management and Budget, the Council on Foundations, the Conference of Mayors. So there's an application process, there's an onboarding process, which I think is relatively pleasant, I hope. We're all still getting along, right? And Austin met that, so we signed the compact around that last year. And so I just want to turn this over to you guys to talk a little bit, and I'll add color commentary as we go by.
Sure, I don't mind at all. Starting off, Rebecca Giello, I'm the Assistant Director of Neighborhood Housing and Community Development here for the City of Austin. So I just want to say, I want to first start by obviously acknowledging that there are several of our partners in the audience. And I think it would be fantastic if you could just stand up, if you have been involved in the GHHI in Austin. And some of you may have left, and if you're here, don't embarrass me, Charles. I think that recognizing our partners who care enough about the topic is certainly a first start. So. I cannot speak enough about the partnerships and certainly the staff that have been working on this issue. In our department, certainly, I know Stephanie would echo the same. One of the things that I think was just so inherently and just well positioned here in the City of Austin is a network around Home Repair Coalition. And the Home Repair Coalition has been around about 10 years. It was seeded and really convened around a group of nonprofits that just had a deep affinity for the issues and a passion to do the right thing around repairing homes and connecting in a very deep and personal way with the families of which they were serving. I also want to recognize the City of Austin voters that have voted for the general obligation bonds, which created ultimately an incredible funding infrastructure that has allowed for that home repair coalition to really build into what we're talking about today, which is something much bigger that encompasses so many more partners. So I think from the perspective of the partnerships here in Austin and the funding of which all of you likely touched in some way if you voted for those bonds, and certainly the elected leadership that put that forward, there's a lot to really recognize and celebrate, and there's a lot to be acknowledged about all that has been done in Austin to get us to this point. So I just would like to turn it over to Stephanie to build on those comments, and I'll help you and support you and augment in this little living room style conversation we're having, which is slightly awkward. I feel like all of you should come up to the stage.
I'm trying to figure out why we don't have tea and crumpets.
Yeah, should have brought my coffee.
I am Stephanie Hayden, and I'm the Deputy Director for the Health and Human Services Department. And one of the things that, from a perspective of Health and Human Services, we work very seamlessly with neighborhood housing and community development, because we think of things from a holistic lens. We think about the social determinants of health, so I was just really excited to see that in her slide, because that is something that as partners we all have to look at that. And so as we kind of expand out and think about partnerships, because partnerships are so very critical to how we are able to get our work done, not just as the city of Austin, but just as a community. It's key and integral for the way that we're able to progress. So as we're moving along and working very closely, with neighborhood housing, with Austin Energy, the contracted partners, we just really appreciate the fact that Austin continues to look for ways of how we can help our most vulnerable citizens. It's just essential for us to ensure that we prevent, we promote, and we protect as a city. So I'll turn it back over to Ruth.
Yeah, I just want to take you through a little bit of where we are and what we're doing in Austin. And I think one of the things that we have learned here in Austin, and I would say Austin was better at this than other cities. One of the things about GHHI as we began, so Sarah Norman, who is here from NeighborWorks, when she worked at the Baltimore City Health Department, knew us as the Coalition to End Childhood Lead Poisoning. We did not know that 10 years later we would be working across the country as Green and Healthy Homes Initiative. But when we began this work, there were 10 cities that were designated, co-designated by the White House and ourselves and the Conference of Mayors. And they've been quite good and really wonderful partners. But as GHHI has grown, there's been two things that are really critically important, or several things that are important to success, and one is authentic demand. A city that wants to do it, not that they've been designated, got called by the White House and said, hey, by the way, you are a Green and Healthy Homes Initiative city, but a city that has looked at a platform of collaboration, that has looked at a desire to build a learning network and to strengthen its nonprofit and other government partners in the braiding, is a marker from the beginning and a requirement at this. But it's been a real reiterative process to learn about data, to learn about where do we look at and investigate every program that a city has as an opportunity to improve the alignment to achieve better health outcomes, better economic and educational outcomes, better social outcomes, while lowering maintenance costs, and stabilizing families. So Austin has gone through this, what we call resource and gap analysis, and that is now a living way of doing the work, and the housing and health departments have been incredibly good. The first $1.2 million of investment, which I think we call the Holly bonds, right, have yielded about 200 homes that have been improved and are healthier because of the work. And they're being braided in, and we're looking for opportunities of how we braid in and lift all the boats in that, and how do we strengthen what's happening. The next process for Austin is that it will bring in an outcome broker. This is the person who is going to be looking at the evidence-based practices. How do we do long-term sustainability on articulating savings that are created, the outcomes that are created, the case studies, which are critically important. I didn't get as much a chance to do it today, but I'm in my most comfortable place when I can tell stories about families and about the outcomes of families, and those are really important, the moral case, the human case, and the business case together. That outcome broker will be looking at resources, right? How do they bring in the $42 million of investment? How do they pursue the Medicaid funding or healthcare investment or utility investment? How do we understand cashable savings and translate that into reinvestment? And so all of that comes out of the learning network and out of the outcome broker. Well, that slide's not going to do as much good. So that's where we are looking to build, so that Mayor Adler, the city manager, the city council, really is looking at what's the value add, and to be a city that says, when we do something on housing, how are we improving social determinants? How are we articulating them, discussing them, and documenting them in ways that matter, that are empirical and credible, but important. And in a city where, like Austin, you can look around and see the cranes everywhere. And to see this challenge of cost of housing, of what do we do with the existing housing stock to make it affordable and stable for people who are working here, who are not necessarily making the tech salaries, but have to still pursue the health agenda. And so it's really critical that this is driven by a unification of health departments and housing departments together. And, you know, I'm an East Coaster, and I have been just, you know, so we always have our views about the world, right? And I have been incredibly impressed with the willingness also of Texas Medicaid to think so progressively about how they can start to come in and support our work in Houston, the work in San Antonio, and the work here in Austin. The other thing that we learned, and then I want to stop talking, but we learned out of of success is you have to have the electoral leadership has to be in line and be behind it. I told Mandy a story last night where when I had an opportunity to address the city council here, one of the city councilmen said to me, well, don't you need a couple more, can't we get you a couple more $1 million to help scale this and propel this? I turned to the city official who was co-presenting with me and I said, let's just stop talking and leave because we're way ahead. So it was another good moment for loving Austin, but I'm happy to have us continue to talk or take questions around what we're doing.
I would like to just kind of touch on a couple of things, and then we'll do what Mandy tells us to do. One of the really interesting dynamics of where we found ourselves with GHHI, and again, this is not a program per se, it is a delivery of our services, is we have had a program called Holly Good Neighbor Program in Austin for a very long time. And we had found ourselves not being able to move those funds, really working with the neighbor, wanting to recognize that the movement of those funds needed to be synergetic with the neighborhood's desire. And so the Green and Healthy Homes Initiative for us was really essential in looking at how we could creatively target those funds differently, and there were very specific things that we could engage in funding to get those costs to the residents. So when you bring in all of the other factors that you can look at from a programmatic level, like trip hazards, we have been able to move those dollars that have been really sitting there needing to get out to the community to be helpful in less than a year. And these dollars had been sitting there for a number of years, all with the community engagement aspect behind it. So I would welcome anyone looking at how you can innovate and look differently at how to move money as quickly as you can to the folks in need, to look at a delivery model that really opens the doors to not just the funds that can come in, but how you get the money out. And that's been very helpful. I just wanted to comment on that, but we're happy to take questions.
I was going to, again, encourage people to use the note cards on your table. Write your questions, raise them up. We have a couple of volunteers who will be bringing them up to the stage to Ruth Ann for questions about the Green and Healthy Homes Initiative. I would love to find out, because I was intrigued, about how this works at the really basic level. I have a problem in my home. How do I access? I know it's not a program, it's really a braiding of different services, but if you could walk folks through, because a lot of people do not know about what GHHI actually means for our community.
Sure, I can start if you want it. But so GHHI has been described as a new way of doing business. Not so new now, right? We've been around a number of years, but that's how it's a platform. And I'll give you a little bit of contrast, right? In various places, we work on different issues. So we're in Marin County, California, which is a very wealthy place that the median home income is $978,000, but we are in the very low-income neighborhoods, 17 villages, and working to lift and stabilize families there. And their goals are to address energy efficiency and aging in place. issues around falls, and you mentioned falls, and just real quickly wanted to say, high dollar return, $222 billion of cost around injury, right, in the country, really low cost, high return. But for GHHI, there is a, Megan, I think I heard her talk about the wrong pockets issue, but there's the no wrong door, right? A family has a roofing issue, they have an asthma issue, they have a lead issue, they have a pest management issue. Whatever will get them into the housing or health system where the house is the root cause. The GHHI platform is built to share those families and then move to a comprehensive, holistic assessment that is braiding together the assessment around toxics, around safety, around structural issues, around energy, but also doing an assessment of families and the human beings and the both behavioral health needs and the health needs of families as it's tied to their house. So it's looking that comprehensive assessment is done, and then that data is shared with all of the pertinent departments it needs to be shared with. And that's where we start the process of an environmental health educator teamed with the environmental health assessor, who's multi-trained on all of those levels, working together through the assessment period, the crews that do the cross walk on the actual housing interventions, that environmental health educator, you can call them a case manager, they're often asthma certified educators that are walking through and doing reiterative education, doing very simple things with families if they have asthma, like using the asthma meds properly and following clinic information back to clinics, and going all the way through to quality assurance and then follow up on a periodic basis, all the while collecting pertinent data without it being a research project to let us know if we are achieving those outcomes, if we need to go back, and it is to look at that continuum with housing, the human beings, and the structural work together. So I hope that answered your question. Okay, ladies, you got questions?
We're going to give you these long ones.
Okay. Can you share more about how GHHI in general and GHHI in Austin are assessing and evaluating health outcomes? Sure. And a template, pre and post test that is adapted to specific sites. So we do have a comprehensive assessment tool. It is adapted to sites, adapted, right? The right word there. But it is looking at the whole family who's living there. It's looking at the needs of seniors as well as children and families. It's looking at issues around asthma and respiratory health. It's looking at any poisonings or injuries. Obviously, the bent is on preventing those, and we will collect that data up front. And if there are existing home-related injuries or illnesses, we will be tracking and are tracking in that assessment the improvements and outcomes, sharing those with the health partner, but also looking at metrics. And we do have to re-enter houses in some of our sites from time to time. For example, where we have kids with asthma, we do a repetitive use of the asthma control test. And if we see any change or score that makes us want to go reinvestigate, or based on the family's interaction, if there's something that goes back in that. So I hope I answered that question. Why don't you take yours?
Locally, how do we better link our health community, external, the city, with NHCD and GHHI? I'm going to say, one of the things, and I don't know why I'm talking in this mic because I'm mic'd, so I'm double mic'd.
You wanted to be heard.
I did. Can you all hear me though? Yeah. Great. Okay, so I'm going to say, connections are really, really about building relationships. And when you notice that there is a gap, and from the health department's assessment, we conduct our community health assessment. and we have several partners, that are at the table with us. But as you conduct health assessments to determine the gaps in the community, you definitely want to make sure that you have established relationships with correct partners in the community to be able to move the needle. Looking at the data to determine, exactly what is my desired outcome, but also thinking about if I don't have the ability to do this as the city of Austin, I have to make sure that I am connected with a partner. So in this, example with NHCD, the health department housing is kind of not what we do, but we connect with our partners at NHCD to ensure that we are having those conversations and we have that relationship. And then from the kind of overall GHHI initiative, at the core of that is the data. It is the assessment tool that is used by the service providers when they go into the home to conduct the assessments. And then from that, the connections start to happen and the relationships that you have already developed and fostered are there, and you can link an individual to the particular service that they need to be connected to.
Can I add one quick thing, which is, I think what is unique and not, or what GHHI strives to do is not just be a referral service and a referral network, but it is to drive down from the need of the family and the need of the housing structure to root cause remediation that will long-term sustain for that family and any family that goes beyond and gets to the health result and gets to the economic result to help stabilize. There's a question here around, preserving affordable housing, stabilization of families and being able to drive down maintenance costs, drive down the missing work, drive down the cost, the out-of-pocket wear and tear that families will incur and cities will incur, because if we do not stabilize a healthy, safe, and affordable housing, it costs cities a lot of money when you have the turmoil of toxic or unhealthy housing. So I think this drive from the connection of the health department is to get to an answer and a better solution on root cause remediation.
Okay, I have a dozen questions, so maybe we're at maximum. They're all really hard too, so I'm looking for an easy one. So I'm going to pick on Mike Gerber because I see him over there. I'm not calling on you. I'm saying something. So it says, does GHHI work with affordable housing, specifically public housing or Section 8 housing? Yes. I do think, though, this is a great time to just kind of stop, pivot, pause, and say, Austin is at an interesting place in that we are ready to take that next step. So our next step would look like bringing on an outcome broker and really looking at the political infrastructure. How do we ascertain and gain the right perspective from our policy leaders who are, I believe, directly linked with many more partners that we need to bring on board. And so a couple of interesting things happened when we engaged as a city the conversations with GHHI. It was exactly at the same time that we were moving from an at-large council to a district council. And so that real interesting shift in a political energy, I believe it positioned administratively for the city to take more of an administrative lead. I do believe this would be an interesting and excellent time to revisit the political infrastructure and how do we build on what we already know, which is our policy leaders are deeply interested in moving these kinds of initiatives forward. So I will say that, and yes, it does work with public housing, and I think that in everything that we do, the Housing Authority of the City of Austin is an incredible partner in just how we address affordability in Austin and affordable housing. Okay. Oh, that's right. I thought you were rejecting the opportunity to read a question. You want to? I mean, I can go for another one.
Okay. So it says, what hazards do we address in the GHHI Austin program? That, I mean, we base this on local condition and local needs. Some communities we work in don't have lead problems, for example. The Marin County is a great example of that, or significantly. But we are looking at lead, asthma, safety issues, carbon monoxide, fire safety, hoarding issues. We're looking at pest management issues. We're looking at structural issues in housing, and we're looking at the energy efficiency status of housing. So we look comprehensively at that, and then moving not only with the bond, but the process is to align and braid and better utilize these dollars together, not only here in Austin, but around the country. And you know, one of the things when we first go in to do this work, and Austin has been, I would say, you know, top of the class on collaboration, cooperation, and people driving to the same goal. But in some cities that we go in, we have to do a little bit of therapy to get past perceived barriers to what are the real barriers. And I had the city of Atlanta in for a boot camp where we had the housing department, the health department, the energy department, right, home repair. They all worked literally on the same floor in the same building in the city of Atlanta, but never actually had worked together. And I kid you not, I mean, they had an idea that they weren't allowed to. So their mayor said, you're allowed to, go work together. And at the end of that boot camp, the housing commissioner at the time cried because he said it's the first time they were going to be able to serve children from a housing perspective in the city of Atlanta. Now, most of our partners we don't bring to tears. We like smiles and joy. But it is that there is this real need to look at these things comprehensively and how we do work together to lift all boats. And I don't know where I got to the Atlanta story. So James Shelby's a good guy, but he was a great leader in helping us get that done. Next question.
One more.
One more.
I'll go. How will GHHI Austin access and address negative health impacts at substandard rental properties? And they said properties with high % of low-income tenants addressing without displacement. I think one of the things is when that assessment is conducted in the home, that entity will develop a plan in order to address the items that come up for that household, for example. And just kind of tagging on to what Ruth said earlier. So if there's asthma, there's things wrong with the home, but they'll look at it from a total holistic lens. And so as we are working to improve the home and make the repairs, we're also looking at how we can address the other concerns that are happening within the household. So a case manager would be assigned, and that case manager would be able to, you know, have a conversation with the parents about, okay, asthma and your connection to a healthcare provider. In addition to that, also looking at, okay, because ultimately we have to keep the family safe. So as we're working with the families, there may be a chance that we might have to displace them. And there have been cases, you know, where we've worked together where we may have had to displace someone temporarily, but we'll work with the school system to ensure we get the transportation for the kids to get back to school, back and forth to school. You know, if there's some bus passes, we need to provide for the parents. But it's a case-by-case, individual case. But we ultimately, safety is number one. Number two, we want to make sure that whatever the presenting concerns or challenges are, that we connect them to a viable resource that they're able to address those challenges.
Yeah, and we're helping landlords out to meet costs that they may not, or they struggle with, or know how to. That example I gave of moving down the turnover rates is an engagement in the rental property. Across the country, the portfolio of GHHI is 50-50 on rental property and low-income housing. And actually, it's a pathway for better engagement with the property owner and the tenants, improving both the plight of both. And to date, we do not have data that is showing us at all that we improve the property and the tenant is then kicked out. Because we are doing an engagement between the owner and the tenant. We're building this forward, and we're not taking the unit to a gentrification level that makes it that attractive, because we're not putting in granite countertops and new things in that way. We are going to the common sense levels of safety, of health, stability, and energy efficiency. And we're making a better arrangement for long-term healthy tenancy. And so we are not really gentrifying, but we are trying to address the issue of displacement. I think we're good. Yep.
Thank you so much to Ruth Ann, to Stephanie, and to Rebecca. We really appreciate you being up here.